In the last recording, we discussed the knee joint. Now, we'll be talking about the ankle and subtalar joints. The tibia and fibula are held together at their shafts by the interosseous membrane, but the two bones are mostly connected here at what's called the tibiofibular joint. This is a syndesmosis, or a plane type of synovial joint, held together by the tibiofibular ligament. Very little movement takes place here. So let's move to the ankle joint proper. The ankle joint can be approximated by looking at the prominences of the medial and lateral malleolus with the skin on, which approximate the line of the ankle joint right here. On yourself, the ankle joint can be felt on the front of your ankle as a slight depression between the tendons. The ankle joint, or more properly the talocalcaneal joint, is a hinge type of synovial joint involving the distal tibia, the fibula, and the talus. The distal ends of the tibia and fibula form what's known as the malleolar mortise. A mortise is just a recess into which something fits, like a jigsaw puzzle. And that something is the rounded superior articular surface of the talus, which is called the trochlea. The trochlea is more narrow posteriorly, and so it's not gripped as well by the joint. And because of this, during plantar flexion, the ankle joint is relatively unstable, and this is when most of the ankle injuries occur. You can see how much smaller it is back here. Of course, ligaments are vital to the ankle's stability. The lateral ligament of the ankle is actually made up of 3 discrete ligaments. But it's okay, at your level you don't need to know the names of these. Medially, we have the large deltoid ligament, also known as the medial collateral ligament, and it attaches to the medial malleolus. During eversion, the deltoid ligament stabilizes the ankle joint and prevents dislocation. Let's add some muscles on here and have a look at these movements. The primary movements of the ankle are dorsiflexion and plantar flexion. We can see that here in the motion of tibialis anterior, which is dorsiflexion, and in the motion of soleus, which is plantar flexion. Of course, it's far more dynamic than this, because think about drawing a circle with your big toe. But let's stick with the basics for now. Let's move further down now to the subtalar joints. These are the anterior and posterior articulations between the calcaneus and the talus. Together they form a functional unit termed the talocalcaneal or subtalar joint. It's a single synovial joint where the majority of inversion and eversion occurs. And we can see those here. If we look at the motion of fibularis longus, whose main motion is eversion, and again at tibialis anterior, whose other motion is inversion. And that's the joints of the ankle.